Talk health now. The Nigeria Center for Disease Control and Prevention says it is committed to safeguarding the health of all Nigerians amid reports of rising cases of human metapneumovirus in China and other regions. The agency says Nigeria is at moderate risk for the virus. Director General of the NCDC, Jide Idris, says the agency is taking proactive measures to ensure the public is informed and prepared for any potential impact of the virus. Although no case of HMPV has been reported in Nigeria, the NCDC mentions that it has ramped up surveillance efforts nationwide. Dr. Idris also says as of Monday, Nigeria's National Influenza Sentinel Surveillance System has not reported any unusual increase in respiratory infections, including those caused by HMPV. The World Health Organization has clarified that there has been no emergency declaration amid growing attention to the rising circulation of respiratory viruses, particularly human metapneumovirus in China. Now let's tell you about the human metapneumovirus. HMPV symptoms can be similar to other respiratory illnesses, such as the common cold, flu, or COVID-19, making diagnosis difficult without specific testing. But here are some of the symptoms to look out for: cough, runny or stuffy nose, fever, sore throat, and headache, and as well as tiredness. In more severe cases, HMPV can cause wheezing, difficulty breathing, hoarseness, pneumonia, bronchiolitis, rapid breathing, and retractions, a visible pulling in of chest muscles. To prevent the spread of HMPV, practicing good hand hygiene is essential, including frequent hand washing with soap and water. Respiratory etiquette, such as covering the mouth and nose while sneezing or coughing and wearing a mask, can also limit the spread. Professor of Virology Oyewale Tomori joins me now for more. Prof, it's good to have you join us on TVC News at 7. Just how dangerous is HMPV? Are we likely to experience another global pandemic as a result?
It is difficult to predict right now with what we are seeing, although the problems are rising in China. But remember, we had the same problem in 2020, and it ended up with what we have. So it is better to be prepared and assume that we're going to have a major problem. So that's why preparedness becomes important. And I think one should commend the government for what it's doing right now. Although this virus is quite different from COVID virus, and it's different from other respiratory viruses that we know. And it was discovered first, I think, in 2001. I think it was in Pakistan. Now we're seeing an upsurge of cases in China.
Okay, we also, heard about the Netherlands for it, really. But which age range is more vulnerable to the virus, and how is it diagnosed?
Like most other respiratory infections, you need a lab to provide you with all the diagnosis. Immunofluorescence test, antibody testing, and using the genomic system. Those are the ones that are used. But I think we must remember that this is a virus which we don't have the reagent for it as yet. We have for COVID, we have for influenza. So when the government says we are monitoring, it is important to confirm that we actually have the diagnostic material for this particular virus.
All right.
So I'm sure they're trying that as quickly as possible.
All right, Prof. But can HMPV, the disease it causes, can it be treated, or are there vaccines for it at the moment?
So, as I said, this is a virus which was first discovered in 2001 and which had not caused any major problem before. So there's no vaccine for it right now. The treatment that you give is symptomatic. You treat the person according to what symptoms is showing. And that's all that can be done right now.
There are millions watching and I still get to see this broadcast. What preventive measures can we all as individuals and communities take to prevent the virus?
I think you listed some of those ones. The same basic rules that we use for COVID. good hygiene. People who have this infection can spread it through the droplets when they sneeze. So sneezing into handkerchiefs and all that, because of the way they sneeze, and also they can contaminate your environment. So hand washing, making the environment clean. Those are the steps that we've taken with COVID, and I think the same thing also goes with this one.
All right, and the NCDC says Nigeria is at moderate risk for the virus. What is the implication of that? And do you think that we are actually prepared for another medical emergency as a nation?
I will answer the last question first. I don't think we are prepared, in spite of what everybody is saying. When you see what is happening at our borders, the easiest place to monitor is to stop that coming in through your borders. And we've seen what is going on. A few of us have traveled outside, and we see what we're doing, especially in Lagos. That's the way we should be monitoring things. The forms we are filling are not sure they are following it properly. People are not taking it as seriously as we. I think now is the time for us to look at that situation and ensure that, the border is well protected. The forms that are filled properly. We can't say that now. I think it's a joke what we are seeing at our airports now.
Professor of Virology, Professor Oyewale Tomori, it's always a pleasure speaking with you. Thank you so much for your time on TVC News at 7.
My pleasure, Professor. Have a wonderful day.